The darkness holding me tightly until the sun rises up. I could probably do it in Discord. Discord. Okay, Discord. Oh, it's not slash play. Why can't I hear it? Yeah. Yeah. No, Rhythm's not muted here. See? You have the mute symbol. Me and Rhythm don't. Because I gave Rhythm permission. So that this channel would be special. A special place for me and Rhythm to be together. Let me see something here. Let me see something here. Let me just go ahead and know I'm test on something. You can't hear Rhythm? Okay. Yeah, Rhythm is not server muted. Let me see something real quick. Okay, I can hear it in YouTube video. Oh, it's so bad. It's so good. Okay. Yeah, he's up and unmuted. Let's see. Let's kick him. Let's damn it. Do I have to go to like rhythm.com? No. I did nothing of the sort. Rhythm, why you gotta be a bitch? Girl, dude, if I could have white hair. God damn. God damn, if I could have white hair. I've wanted it my whole life. Never been able to have it. Because I can never hold myself back and I don't like it short. So I dye it black and then I'm not able to ever dye it back to anything normal ever again. With the back hanging down, yeah, I've done that before. I've done it before. Yeah, I know what you're talking about. Where I basically just take the top part and tie it in a knot and let the back hang. Who else had that? Fucking there was a guy in Lord of the Rings. He looks like my dad, Strider. Strider looks exactly like my father. That's what my father looks like. He looks like the dude who plays Strider in Lord of the Rings. Bridges. Traffic lights. I swear to fucking God. Fuck you. I don't want to train cars. Invite Rhythm. It doesn't even look like Rhythm's in the room now after I kick him, so I have to re-invite him. And to do that, I had to fucking solve a CAPTCHA. Now, I can add him to my server. Beep, boop, beep. Now I have to do another CAPTCHA. now I have to solve a CAPTCHA for buses. And I missed one and couldn't find all the buses. Now I have to find all the cars. I want to die. I think I'm trapped in a login loop. I'm trying one last time. Yep. It keeps making me solve CAPTCHAs. And it just keeps on. Ooh. Wait, that time the CAPTCHA just solved. Are you going to join now, Rhythm? Or are you going to be a little bitch? Okay. I don't know. Rhythm is dead. Rhythm can get fucked. Oh, hi, Rhythm. And I still can't hear it. Drunken took Viagra. Good job. He thinks he's playing. Yeah, he thinks he's. Alright, we're, I'm gonna kick Rhythm again. Alright. I wanted to finish this project. Hey there, cutie. Come on! Okay. Export. I wish you could select which YouTube playlist you wanted to export it to from this screen, but you can't. So, a button on your shirt. So I'm gonna listen to this fucking song because I didn't get to. Ah, bye, Yazzie. I killed it. I killed the bot, Sunshine. It's not with us anymore. You can't rely on it. Fuck, the lyrics are so different. Fuck, that is so weird. When I'm working on something, except my browser's frozen. I'm like 5 minutes away from I'm being like ready. If you want, I can just unmute you in the Discord server, and then everyone would hear you. Okay, I'm like kind of over this shit. Okay. When my computer stops having a seizure, my brain's kind of frying right now. My brain is cooking with how Twitch is being a little bitch. I've got water. Does everybody have water? Does everybody have a snack? I just ate dinner. I'm currently listening to this fucking terrible Linkin Park album that's amazing. If you've never heard it and you're capable of playing this in another browser or in another tab while you're watching this, I highly suggest listening to this fucking awful Linkin Park album that's amazing. Add to playlist Dungeons and Dragons. It's already in that playlist. Playlist. Okay, Salty, but stick around because I'm about to talk to Dr. Nick on stream. Love you. Okay. God damn it. This is so frustrating. Fucking time to tag all this bullshit. I want another Fort Minor album. Why do I think it would be fucking good? Twitch, you're fucking up. You're fucking up, Twitch. I have two more. I have two more to do, and it is fucking up so hard on these last two. It's just not wanting me to do anything. In fact, I'm gonna have it reload the whole fucking page here. Oh, and as soon as I do, of course, it brings up everything I want to click on. That's a face I make when I'm drunk as fuck. Why? What? Like that. Describe your video. Here's the fucking description. Export. You sure you want to stop editing? Because all changes will be lost. Export. Oh. Cancel. Save changes. Just export the fucking video. Oh, good. Close the window. That's what I wanted. That's exactly what I wanted to happen. I'm gonna blow something up. I'm gonna get some firecrackers. I'm gonna blow up a mailbox in my backyard in a safe distance from anyone. Don't do anything illegal ever. But fuck the police. Don't you ever. Why? It knows like one set of tags and it's willing to autocomplete that set of tags every time. But it can never learn any other fucking set of anything that I put in there. Just knows this one set of tags. Okay. aneurysm is finally reducing in swelling. And now we can move on from that life. And we can call Nick. Party Popper 6968. Who the hell is that? Who the hell? Hail Satan. Say, Nick. You ready? I'm gonna call you so hard. Let's do it. What the hell? Can I hear anything? Has my whole life been a lie? That's the right. Mr.Bones started a call. Is Discord fucking up? What's going on? Nothing coming through. Let's close Discord then. Join call. Hello? Hello?
How's it?
Hello, Dr. Nick. What's going on? How are you doing, buddy?
Good, and you?
I'm doing all right. I'm having a good night. So, like, what kind of crazy shit are you dealing with right now?
I've got one doctor that tried to frickin' do some stupid shit.
Okay.
He wanted to do an IO into a patient who had perfectly good veins.
What is that?
It's basically we drill a hole into a bone and then put a drip in there.
Why? Why do you usually do that?
We don't usually do that.
Oh, okay.
And this guy decided that he wanted to do that instead of a normal IV.
Okay, for reasons. Like what is this guy? Is he a regular doctor? Is he a student?
First year.
Okay. So he's just he's exploring. He's seeing what's possible.
I don't know, maybe he just wanted to practice.
He's like, I was taught about this thing and I haven't had a chance to do it yet, so you look like you have good bones.
So I told him if he wanted to test it, he should try it on himself.
Ow. God
Because
damn.
it's not a very pleasant procedure.
Were you able to stop him? Did he do it?
One of the nurses ran into my office and called me.
So you have to babysit these guys all night?
I've got to babysit the first years, second years, and third years.
Damn.
And then the rest of the fourth years.
Are you responsible for them, or do you just do it because you don't want anyone to get hurt?
No, I'm responsible to do that. I'm the chief resident.
Okay. So you're also basically like on call 24 hours a day, right?
Most of the time.
Yeah, because you never take time off.
Yeah, but that's mainly by choice.
Right. Not by, a sense of duty.
Yeah, but also when I do take leave, it's usually forced.
Right. I understand like being terrified of leaving the building and being like they're going to light it on fire if I leave. So, I've been there. So let's see.
Yeah, but it's more about what are the first years going to do?
Right, what terrible shit are they going to get up to?
Yeah, you never know.
It sounds like
The
they find
stuff
new and
that I did
inventive
when I was
ways.
a first year,
What did you do? What did you do wrong?
I almost put a drip into an artery instead of a vein.
Ooh. I mean, but that, like, what happens there if that goes wrong? Like, don't you just, I mean, doesn't it kind of seal up around the
Not
needle?
really. An artery doesn't like to stop bleeding without
Mm.
assistance. It was my first code blue, and they told me to put in a line, and I was like, okay. And then
That
got
was
yelled at for going for the wrong vessel.
that was not what
But
you're supposed to do.
nah.
I mean, but how do you know until you do it, and then you
Well, you
found out?
spend about a year before you become a resident going through all of this.
Yeah, so you
But
have to
then as
like,
soon as you get into a code blue for the first time, that all goes out the window
uh, makes sense.
because you're focusing on, let's keep this heart beating.
Right, right.
Not,
Desperately kind of trying to remember anything.
yeah. And then it gets worse when you have to run your first code blue.
What does that mean?
So when you're the person in charge of the code blue, so you're telling all the others what to do.
Oh, I see. I see. Having to manage all the other, like
Yeah, the
the total
nurses, the
procedure.
doctors, and it can get crazy. You sometimes have to kick people out the room as well. And that's a bit weird when you're doing that as a resident and you're kicking out a fully qualified doctor.
Oh, I bet. Are they receptive to that?
Yeah,
Okay. Like
if it's a
they know the
legitimate
rules and
thing.
they're just like fuck it, all right.
But if you go and you try and kick out a doctor that's doing the right thing, you're going to get kicked out before that doctor does.
Okay. And you have to.
So,
So, how long had
yeah,
you been working there before you had to do that?
3 days.
Fun. Fuck.
I got thrown into the deep end
Fuck. Is
very
that
quickly.
normal?
Not really, but we were short staffed that day.
Okay.
And there was no other doctor available, and my patient went into cardiac arrest.
Oof. Yeah.
So,
Guess you do what you have to.
yeah. And then you just make sure that you don't mess it up.
Yeah, great.
Because then there goes your medical license, there goes all of the work you put into it.
What's got to be really fucking frustrating is the concept of like you did everything that you were supposed to do and they die. So it's not like you were in the wrong anywhere that you can easily find.
Yeah, but that is the thing. That happens more often than you would think. There's very few medical mistakes that I've seen that have led to a patient actually dying.
Right, like someone just shows up with not enough blood and is dead.
Like the person comes into the ER and they are already beyond help.
Right.
And you try everything, but when you can't help them, you still feel like you failed.
Yeah.
It's
Yeah, that would kind of drive me a little nuts.
because regardless of what you do, you still question, what if I did this?
Right. Right, and you can
What if I
never
did
have the
that?
answer to that question, so you're just kind of
So you kind of have to put that into a box and throw the box away,
that makes
or
sense.
else you cannot treat the next patient.
Yeah, you'd get very consumed by it very quick.
Yeah, because then you'd be second guessing yourself when you don't have the time to be.
Working with dogs, that only happened to me like, maybe 3, 4 times over the whole course of my 8 years. How often does that happen to you, like in a year? Or is it daily?
Every time a patient goes,
Is that like a daily thing?
ah, it varies. It's almost like it comes in seasons.
Oh,
Because you'll go through a period of no death, and then when it's a period of death, it happens more than once in that period of time.
oh. So you don't have a lot of time, yeah, to before you have to start on the next one then.
Yeah. And also, it's generally one patient to the next. It's not one patient break, one patient break. It's patient, 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 patient.
Do you think that that is part of the reason why you don't take breaks?
I do try and take a break now and again, but when I have taken breaks in first year is when I got in big shit for setting off smoke detectors.
What? You just kept smoking in places you weren't supposed to?
I didn't realize there were smoke detectors in the staircases used for emergency evacuation.
Okay.
I learned out the hard way.
So you were pretty stressed out taking lots of smoke breaks.
Yeah, but now I stick to doing that by the ambulance.
And you'd say your stress levels are under control?
If a doctor says that, he's full of shit.
So what do they have for you guys as far as like mental health care treatment for when you lose patients and stuff like that?
Well, we have group therapy sessions that we can go to. They about 3 times a week, 4 times a week, I think.
Okay.
But I've only gone to one. I haven't
Was it
really
weird?
gone to many. It's a weird vibe when you walk in there because you're all going to be talking about patients that you feel that you've failed when you haven't really failed them.
Right. So everyone's kind of on that wavelength to begin with.
Yeah, and then you've got to go at least once every 3 months to a psychiatrist, and you've got to see a psychologist every 2 months or 3 months, and
Okay.
depends on the hospital, depends on the requirements that each hospital has.
But at least they require that you guys check in with somebody so that way you can't fall completely off the deep end.
Yeah, it's also just a bit weird when you don't feel like you need it, and at a
Right.
specific point you actually don't, but then you have to go.
Hmm. You have to just go and prove you don't need it.
You go and you sit there and you talk about what?
Why you don't need it right now. Why you're
Yeah,
feeling
and then
good.
if you do that, then they generally send a report saying you need leave.
Because you do. What have you seen as far as doctors like in the way they react to stress?
Okay, I've seen alcoholism, drug problems. Um, what else? Some
You,
doctors actually just get addicted to golf.
well, that sounds healthier than the other options. Now, drug abuse in doctors, you would think, would get spotted by their coworkers pretty quick.
Yeah, you don't really have that kind of time in the emergency room generally.
I see.
Because in the emergency room, it's constantly busy.
So cocaine is popular?
Not really, it's mostly prescription drugs.
Oh, okay. Downers or uppers?
Both,
Okay.
depending on the doctor.
Huh. I don't know
And
how I
then there's
feel about the
sometimes,
concept of like my ER doctor being fucked up on something.
yeah, but I have spotted it a few times, and they've all gone to rehab, the ones that I've spotted, whilst
That's
they
good.
lose their medical license.
Okay, well, there's that. Just feel like I guess if the system pushes doctors to that point, that's scary already.
Well, if you look, there's not really enough doctors.
Yeah, that makes sense.
Globally, we do not have enough doctors. We've got 7 point something billion people,
Right.
and I'm not even sure how many of them are doctors.
Not enough.
Not enough, that I know for sure.
And then, of course, you have like a lot of them focused in cities, not as many in rural areas. But you still need
Yeah,
just as good of medical support if you live out on a farm somewhere.
and that's the other thing. If you look at rural areas compared to urban areas, you've got what? Sometimes 600? No, not 600. What's it? An hour or 2 hours until you get to the nearest operating room.
Right. Yeah.
And then that operating room is generally got antique equipment,
Yeah.
and
Unless
you
you
can't
drove
really
into the
perform a
city.
surgery there. But that's why doctors are still taught to do things without the modern tech.
I guess that's pretty useful, but at the same time, like, I don't know, maybe we should train them. I know that it's one or the other, right? Like you can't be like both are important, but they are
You taught both.
good. Yeah, because I can see a lot of opportunities where being a doctor and not having any tools is what is happening.
Just think about if you can't, if the sonar's broken
Yeah,
and you only know how to place a IV into a artery using the sonar, because arteries are deep.
right.
So you've either got to feel it or you got to use a sonar. If you don't know how to use the feeling method and the sonar's broken, how are you going to do it?
Yeah, you're basically fucked. I was thinking even more rudimentary, like the stereotypical, like you're on a plane and someone is dying and someone's like, "Don't worry, I'm a doctor." Like it's useful for that guy right then to know how the fuck to do things without tools.
Yeah, or improvise.
Yeah, give me a tie and a pen. Like,
Yeah, I still think that if you can avoid doing that,
right.
because a pen is not the most hygienic solution there.
No. What do you do if, like, I guess I'm thinking of like the pen is the tracheotomy move, right?
Yeah, we call it a trike because we
Right.
shorten everything.
Okay. So what would you
Um,
suggest if you're in a pinch and you need to do that to somebody?
I would prefer to use a trike kit.
I have a pen. I have a pen right now.
Then give me some very strong alcohol.
Okay. So make sure you use strong alcohol to clean it first. Check.
Yeah, but you can't use a pen like that. You first got to disassemble it.
Right. You take the ink out,
You
right?
need a hollow tube.
Yep.
So another thing you could use these days are those metal reusable straws.
Oh yeah. Are those sharp on the end?
You don't want to use something sharp. That's why you usually make an incision. In the
Okay.
movies, when you see them take a sharp tube and just shove it in, that is not the way you do it.
So you want to cut a hole and then put something in the hole?
Yeah. So you feel for where the Adam's apple is.
Okay.
And then right there, you make an incision
On it?
vertically.
Okay.
Then you put in a tube, preferably a sterilized tube.
Yes.
And you got to make sure that if you use an improvised tube, that it doesn't move when the person breathes.
Okay. Like it
Because
can't
you
be
don't want
flexible.
that it can be flexible, it shouldn't be, but you want to strap it, you want to support it so that it doesn't come out, doesn't go in deeper. Because if it goes in too deep, it
Oh,
just
okay.
blocks the one end of the tube, and then what's the point?
Okay, I see what you mean. Yeah, if it goes too deep, it would hit the other side of the esophagus and be
And then
pinched.
no air is going through, or well, very little air is going through, which is pointless.
Right. See, this is the information we needed. This is the good stuff.
I'm just gonna switch off the smoke detector. No, it goes off with these electric cigarettes as well.
Oh, does it? Vaping too hard.
Yeah, I don't use the vape. I use the thing where you put tobacco in the thing and it just heats it.
Oh, gotcha. Like we used to do that with weed, obviously, where we'd vaporize weed in a thing, and that's actually how I smoke my weed now, is through a vaporizer like that. But
Yeah, you see, my coping mechanism is nicotine.
hey, better than drugs.
Yeah, I've got enough prescription drugs at home, but I don't
Yeah,
use them like that,
I saw the
as you've
table.
seen.
Hey, so is Suboxone big out there?
Suboxone.
Suboxone is used here for heroin addicts as a recovery. It's like methadone.
Let me check the medical website. I haven't prescribed it before.
So we have now a raging spring of addictions to this shit that is what they give you to help you quit heroin and fentanyl
Yeah,
and oxycodone and shit.
Suboxone's not legal in South Africa.
Good. Fuck. God damn it. Why is our medical system so stupid?
Let me check methadone. They talking about rolling it out here, but
So what do you do for addicts?
rehab, get them
No,
off it and try and keep them off it.
you don't use any prescriptions?
Some rehabs, it's controversial, but they use opioids to slow the withdrawal down
Okay.
and then slowly taper the dose off.
And that's the same concept by switching people to methadone or Suboxone, is that they can control that and slowly taper.
But what generally happens is a lot of the rehabilitation centers here just go cold turkey.
Damn. What kind of rates do they get, do you know?
I haven't actually checked the stats before.
It'd be interesting to see, and be interesting to know how many people come back to.
Let me log into this.
Do you have cool methods for finding these numbers, or are you just using the internet?
No, we've got a part of the medical association.
Okay,
We have access to statistics and things through a portal.
that's nice. That'd be useful just for research.
Yeah, but you need a medical license to access it.
What a bummer. Like, just let me read the secrets, damn it.
And we're not even allowed to share the stuff.
Do,
We're allowed to use it in our own research, but we're not allowed to share it.
so you can cite it? Wait, no, for your own research. So like
Yeah.
you can't then publish your research is the
No,
problem.
you can publish your research, but you can't take it and post it on the web.
Okay. All right. Fine.
You have to use it as a source in a medical research paper.
I was trying to figure out how many I was trying to figure out what percentage of American men died in 2018 of suicides. And finding that statistic involved coupling together about 5 other fucking statistics from other websites.
Yeah. That's why in South Africa we have this portal.
Yeah. That's what I mean. Like
Where
something simple like that where it's like
all of the statistics are stored. So whether it's for government hospitals or private hospitals, all of the statistics are combined.
Fuck, that's awesome.
And any doctor can go on there and pull anything. Dentists have less access.
Fucking teeth drilling bitches.
Yeah, if you fail med school, that's where you go.
Are you
I
serious?
didn't say that.
Why? Why are they looked down on? They are valid.
Okay, so
They're
what does a
necessary.
dentist basically do?
He
What
is
is their
in charge
primary thing?
of your
What's their
oral
primary
hygiene.
treatment that they do?
They remove.
No, their primary treatment is cleaning.
Okay, yes. It is mostly about keeping your shit clean.
So,
Okay. I mean, but that's
also,
also who
I
you see
don't
if your
like
teeth are
a
like
lot of
rotting out of your
dentists
head.
because a lot of the dentists I've met abuse nitrous oxide. For
That
those that don't know, that's a laughing gas.
it's fun. It's like wouldn't you? Come on now.
No,
No, that's just in movies, right?
I've got access to morphine and I hardly use it.
You know what I would be
I've
using a
got a
lot of?
prescription for it,
I
not written by
abused
myself.
um I abused saline solution. I would get wasted and then I'd go to the dog rescue the next day and I'd give myself like a saline hump.
Doctors also do that, to be honest.
It's like I'm gonna do this shit because I'm
So
I'm
here
I'm
we go. In South Africa, 247 million people admitted to using drugs in the past year.
247 million.
Uh, no, this is worldwide stats. Sorry,
Oh, 207 million.
worldwide. I don't know why I'm
But
getting
but
international
yeah, that's
stats.
not going to tell us like what rate the rehabs in South
29
Africa are doing.
million suffer from drug use disorders.
Okay, but that's still what the fuck? How do they? Wait a minute. They're saying that there's a difference between people admitted to doing drugs and people who have a drug
Okay,
use disorder.
so
Okay,
you
yeah,
get people
currently
who
addicted to
like try
drugs.
it.
Right.
You're like, I'm gonna smoke freaking crack once.
Yep. Yep. And then we're saying that a close to 10% of those people end up with an addiction.
Well, yeah,
Yeah.
a bit more than 10%.
Yep.
It's 29 million. And then only 1 in 6 worldwide go into treatment.
Okay, so 1/6 of 29. Fuck. Calculator, come to me. 29 divided by 6. 4.8. 4.8 million people are going to
And
go
now I'm
into
getting
treatment.
random statistics about cigarettes and alcohol.
Drug tobacco company.
Worldwide, between 80,000 and 100,000 kids start smoking every day.
Well, that's not what we're talking about.
Oh no, that's in South Africa.
How many kids?
80,000. Oh, that's worldwide. Sorry.
Okay.
This thing is really messed up today. They did some update on it yesterday, and now this whole thing is
I did a bunch of
shit.
research back when I was getting into the electronic cigarette selling business, and at the time I found that 1 in 3, no, 30% of Americans smoke, but like 45% of Japanese people smoke.
Yeah.
My mind was blown. I'm like, that's almost every other Japanese person fucking has cigarettes on them right now. Like, That's
So
a
in South
lot.
Africa, 122 kids for every 1,000 kids have fetal alcohol syndrome.
That shouldn't be a number per thousand. That's
I don't write up these statistics.
hey, I
I
know.
have access to them.
You are accessing and I am providing commentary. That should not be a number you measure in thousands, guys. Fetal
The use
alcohol
of
symptoms?
dacha has increased by 20% in 2 years.
DACA?
Marijuana.
Oh, well,
It's a
good.
South African name for it.
Good. Good for South Africa.
1,500 metric tons is used annually
By the world?
in South Africa.
Nice. These people are smoking a whole bunch of fucking DACA.
South Africans spend 3.56 billion rand on dacha a year.
Yeah, that's the whole kick. Once you nationalize it, once you legalize it and decriminalize it, and then grow it nationally as a national product, because that shit can grow
It's
on
illegal
sand.
to sell here still.
Yeah, well, they
You're
need to
allowed to
change that.
No, you're allowed to grow it for
Oh,
personal use. You're
oh,
not allowed to sell it.
well, that sucks because a lot of people who need it for health reasons can't grow it.
Yeah.
And that's why
And
you want to authorize patient that's why if you do medicinal, which is the other, if you don't want to decriminalize, you go medicinal, so that way like patients are allowed to sell it to patients but not non, so you can't open up a shop.
yeah, but here, South Africa is the largest user of mandrakes.
Mandrakes?
Yeah,
Why? What do you do with those?
they smoke it.
uh, I've never heard of it. Smoking mandrax.
Yep.
A mandrax tablet is usually crushed and mixed with daga and then smoked in a daga pipe, or better known as a bottleneck, which is also, as the South called, white pipe. In fact, it is smoking of the bottleneck that causes the distinctive stains on the palm of the hand of a mandrax user. What the fuck am I talking about? It's not mandrake. I thought it was mandrake. It's mandrax. It's like a cool dragon's
Yes.
name. Methaqualone?
Yeah, that's a chemical name. I'll post it into the Twitch stream.
Yeah. A synthetic drug that is compiled by means of mixing chemicals in a chemical process in a tablet. Active ingredient in mandrax is methaqualone. 60s and 70s, these tablets were prescribed as sleeping tablets.
You can generally find these people because it's worse than meth with the amount of teeth they lose.
Fuck.
And then here,
Oh, no. Okay.
ecstasy.
Yeah. Ecstasy. Okay. MDMA.
Yeah, 110,000 people used it. Approximately 110,000 people used it last year, paying approximately 610 million rand.
What was the. Okay, so 100 and how many thousand?
110.
110,000 used MDMA, paying how much rand?
610 million.
Okay, and what was the number for mandrax?
There is no number.
Oh no. Okay, I was going to compare the
It
two.
just says the largest.
Oh, it's just the largest consumer of mandrax.
Yeah.
Oh my god. Okay. Clandestine laboratories arose in the following countries: India, Pakistan, Kenya, Tanzania, Zambia, Swaziland, Mozambique, South Africa,
Yes,
and the
Swaziland
Far
is basically
East.
part of South Africa.
Why mandrax? That's a good question. This website.
I do not know.
Experience has shown mandrax is smoked to get greater rush. This is because the toleration effect of of the body of the human who started experimenting with small amounts of daga will later have found to add mandrax to achieve the same effect. It gets you more high? Hell yeah, I need some.
No, this is an
It's gonna
extremely
get me more
dangerous thing.
high. I need it. What if we do it in small amounts?
I've
The
had
drug.
people die as soon as they've arrived in the hospital from this stuff.
Fucking what? Okay, so it's showing me the original tablets. Mandrak's currently confiscated varies drastically, and they look like, yep, these look like the tablets of ecstasy I've had before. So it looks
Yeah,
like they
it's
press
not
them.
like ecstasy. No. Cocaine usage in South Africa has increased by 20% in the last 2 years.
What's going on? Everyone's just having a good time? I always see, okay, so sometimes drug use is pinned to greater economic things, right? Like a war happening
Yeah,
somewhere.
like it says here with regards to crack. Crack is a drug of choice amongst prostitutes.
Well, that's just derogatory.
Well, statistically, if I look here, number of patients brought in,
Okay,
and you
so
look at
that
the percentage of
all
them
that
being
means
prostitutes,
all that means is
is
that
90%.
it is the most dangerous drug to do if you're a prostitute. Not that it is the drug of choice. The drug of choice might well be marijuana, and they're all smoking it, and everyone's high, and everyone's having a good time. And then
But arguably,
some of them
marijuana is
smoke
safe.
crack,
Is
and
safer.
then, yeah, but they might be doing
Not
some
safe,
MDMA
it's
too.
safer.
They could be doing stuff and having a good time, and it's this shit that they get. This is how statistics get all herky jerky. Is
Like,
this
okay, have
like
you heard of someone dying from smoking too much weed?
no? We've had this discussion that it's just not even remotely possible.
Have you heard
Like,
of someone dying from too much crack?
I mean, I don't know. I've definitely heard
Yes.
in both cases of people dying of cardiac arrest.
Okay, when it comes to the marijuana, the weed,
Yes.
the only reported medical cases of someone dying from that has been when someone has been playing with THC 100% extract.
Mm, yeah, that could make you trip the fuck out if you're not a heavy user. I've smoked it before. It's good stuff.
Okay, no. I'm talking about lab quality.
Yeah, okay, so we can get this cool stuff called THC or CBD crystallate, and it is a
Okay,
crystal you
no.
smoke.
No, I'm talking about the stuff that we have in labs here.
I need it.
Now,
Okay.
if you look at the flavors for your vape,
Yeah,
there's nicotine in there.
right.
Now, it's a small amount of nicotine in that bottle.
Right, mine's 12 milligram per
Yes.
milliliter or whatever.
Now, I can't remember what the quantity is, but it's a tiny quantity. If you spill pure 100% nicotine liquid
Yeah, I've heard
onto your
this.
skin,
Or I've
you
had
can
this
die.
affect me in the sense that I've had a bottle leak in my pants and I start feeling really nauseous.
Yeah, that is extremely, extremely
Don't
a
carry your
weak
bottles.
side effect that you've
Right,
experienced.
right,
Because if you had done that with 100% nicotine,
right.
you wouldn't be on Twitch right now, to be
Yeah.
honest.
Oh God, I actually have a really bad memory of. I went to Disneyland and
Let me
did a
see
lot
if
of
they've got
acid
the fatal
of
amount
nicotine.
for nicotine.
Okay, I want to know. Yeah, the fuck. I'm still reading about mandrakes too.
Yeah, please bring me a coffee, Ashley. Thanks.
Smuggling mandrakes in 1,000 tablet
Nicotine
packets.
poisoning between 30 and 60 milligrams. Now, remember when you smoke, when you're using a vape, maybe a 60 milligram, maybe a 64 milligram bottle, but that's the total bottle.
Right. That's what I'm thinking here. So this is like 12
So
milligrams spread over 60 milliliters. So not even like this isn't even 12 milligrams per liter. Like,
yeah.
um,
Now,
let's see. This one is
the thing
stronger.
is, if you take between 30 and 60 milligrams of pure nicotine and put that in someone's skin, there is a huge chance of someone dying.
Hmm. No, this is 30 milliliters with 50 milligrams. So if I just poured this all over
That's
your head,
also why,
you'd
if
probably
you
get
look at
sick.
these bottles, I'm not sure if they're the same in the US, but they've got a child lock on them.
Yes. Yes, we do. Yes, we do.
Reason for that is a kid drinks that,
They're dead.
not going to end well.
All right.
Um, but the
Boiling
thing is,
cigarettes.
you cannot smoke enough weed to get to that toxicity level,
So
because you will literally, before you even get there, you'll get too sick to start to continue.
that's true, and you wouldn't be able to keep
The
smoking.
same thing with cigarettes. If you were to smoke cigarette after cigarette after cigarette, what happens when you chain smoke too much?
Makes you feel sick. Makes you throw up.
Yeah. Are you going to continue smoking?
No. No.
It it stops you.
Yep. Even pouring it on my skin made me not want to smoke it anymore because the whole like even the thought of nicotine made me feel sick.
So if you look at things like nicotine, weed, they're relatively safe in terms of that.
Yeah.
I'm not talking about the other stuff,
Right.
the other health hazards of it. But you look at heroin, the fatal dosage is extremely tight. When you look at the amount needed to have the effect
Yeah.
and the amount needed to kill someone,
Right. It's a very narrow
between
window.
there is very narrow. Specifically when someone hasn't got a tolerance to it.
Yeah. Yeah, a lot of people
That's why a
die
lot
because
of
they quit for a
people who
while and
try
come
it the
back.
first time land up overdosing the first time.
Yep.
Because it's extremely hard to keep in what we call that range in a normal medication is the therapeutic range. So you get
Mhm.
a level where from there you get benefits,
Right.
and then you get a level where it causes problems. And a lot of medications have very narrow therapeutic ranges. That's why doctors look at weight and do blood tests and things for certain medications,
Right.
specifically things like chemo drugs.
Okay.
A lot of chemo drugs have a very narrow therapeutic window. And even that therapeutic window has extreme negative side effects.
Yeah, I mean,
Chemo's
obviously, I've
not,
heard of there's a lot of trade-offs for getting a good level of chemo.
yeah, but also, do you know what one of the side effects that a lot of chemo drugs share?
What?
Causes cancer,
Ooh.
but another type to what they're treating.
And at a lower risk than the rate at which the other cures it.
Well, not quite. I've actually
Yikes.
been on 2 chemo drugs.
Okay.
Not for cancer, for lupus.
Right.
The first one, the one that I'm currently on, is called methotrexate. Now, its therapeutic range is quite manageable to do. Trexate. Let me pull this up. Okay, side effects. If you look at the side effects, liver damage, stomach problems, leukemia type issues, uh, predisposition to infection, abdominal pain, fever,
Shit.
acute pneumonia.
So I guess the idea I always was told, or that was given to me, is that with side effects, your risk of having the side effect is always lower than the effect rate or the cure rate of the drug you're taking.
Not always. Okay, this is one of the biggest issues we're currently facing. Superbugs.
Right.
If you look at the antibiotics we're using to treat superbugs, as superbugs become more and more resistant, we've started using antibiotics that were taken off the market for being too dangerous.
Oh. Okay, so now we're cutting closer to that line of risk versus reward.
Yeah. It is an extremely dangerous medication, some medications,
Have you had to
specifically the
use
ones
some
we
of
use
those?
for superbugs. I've prescribed it.
Okay.
Thankfully, I've never been on them. I do not want to be on them. I hate putting my patients on them because the side effects are horrible.
What was the case where someone is resistant to other forms of antibiotic?
I had a case where the person had multiple resistant tuberculosis.
Oof.
So it was resistant to more than one antibiotic.
Yeah.
And the way we treat that and find the antibiotic is we literally take a swab of the bacteria, the virus, well, in this case, bacteria. When we do it with viruses, we're testing for antiviral resistance, but it's the same
Right.
process where we then create cultures and then we test by putting a little bit of each antibiotic or each antiviral and then seeing which ones they are
Which ones affect them?
resistant to and which ones are effective. And
Okay.
then we use the effective ones. Now, sometimes we take the effective ones and do trade offs in side effects by using a combination.
Right.
Because then what you can do is you can use a lower dose of one so you don't get high chances of certain side effects.
Right.
And then you can use another one, lower dose, so you don't get certain side effects. And that way you can manage the side effects a little bit. You don't have complete control, but you have a bit more control.
Yeah. We've had to do that with some of my meds where we kind of balance the dosages between them because we don't want to go too high on one of them.
Yeah, you're basically doing a trade off between the different side effects. Um, then the other one I've been on is called cyclophosphamide.
Okay.
Um, when I read about it in my medical textbooks for the first time, guess what its description was?
What?
The first sentence was the most dangerous medication approved by the FDA.
Ooh. Yikes. Interferes with the growth and spread of cancer cells in the body.
It has a very small therapeutic window. It can cause bleeding from the bladder. Let me type this into Twitch. It's a very lovely spelt name.
Yeah. I spelled it incorrectly a few times.
Yeah, it can cause other types of cancers.
Man,
It can cause lymphoma, leukemia, transitional cell sarcoma, carcinoma, sorry, um, skin cancer.
damn.
It is literally one of the most dangerous medications ever approved.
So this is used to. This is like for specific forms of cancer.
Yes, but it's also used as an immunosuppressant.
Right. That makes sense.
So we use it for organ transplants sometimes. Um, certain syndromes involving the kidney.
Basically, if their immune
Um,
system is going crazy.
rheumatoid arthritis,
All right. Yeah.
lupus. In rare cases, we'll use it in antiphospholipid syndrome, but
So
we try and
exactly?
manage antiphospholipid syndrome with blood thinners.
What exactly is lupus?
So lupus is it's a weird disease in a way because you can take 100 lupus patients and they'll all have different symptoms.
Okay.
Um, so what happens with lupus is your body produces autoantibodies. Autoantibodies are antibodies which attack yourself.
Right.
So they're not supposed to be there. And depending on which of those antibodies you have, depends on which part of the body, which part or parts of the body are affected.
Okay.
So you will land up with symptoms like arthritis, um,
Right.
what we call lupus nephritis, which is kidney damage from lupus,
Okay.
neurological lupus, which is damage to the brain, and it can basically attack any organ, any tissue in the body.
And it's identified mostly by what it has attacked.
It is mainly identified by what's called an ANA, which is an anti-nuclear antibody.
Okay.
Now, that's where the problem comes in. Diagnosing lupus is a pain because not everybody has the anti-nuclear antibody. Not everybody has problems in their CBC,
Okay.
which is their complete blood count.
Hmm.
Not everybody has problems on their X-rays. Not everybody has things that you can just test for.
So it's one of
A lot
those
of this,
zebra illnesses.
it's one of the great imitators as well,
Okay.
because you can have symptoms that look like others.
Right.
Now, there's a few types. You get neonatal, drug-induced, discoid, and systemic. Um,
Okay.
so the drug-induced one, you stop the medication, the lupus disappears after a while. Systemic lupus, they're permanently.
Hmm. Something is
Um,
causing it forever, and they're always going to have to keep it in check.
yes, discoid lupus is mainly to do with the skin, and neonatal lupus is the same as systemic, but found in kids, in neonatals.
Yikes. Okay.
It's generally found in infants where the mother is got lupus, where the mother
Okay.
is lupus.
Where she's like passed it on, or is just her
Yeah,
lupus is affecting the baby?
no, it's a genetic disorder, so it's
Okay.
passed on.
Okay.
and it can actually be
Now,
quite serious when they're born.
if someone with lupus is pregnant, wouldn't there be a lot of complications in and of itself? Just the immune system might try and attack the pregnancy.
Yes, that's where you got to tightly control the immune suppression.
And I was saying, any medication you give them to suppress that could poison the baby.
That's why you got to stay away from what we call pregnancy category X,
Ooh.
which is any medication that cannot be taken during pregnancy or after birth for a certain period while breastfeeding.
Yeah.
It is, for example, the cyclophosphamide. You can't do that while pregnant. You cannot do the methotrexate while pregnant. Another common treatment, mycophenolate, you cannot use because they all put the baby at risk.
It rules out all the most powerful stuff then.
Basically. So you're kind of screwed.
Yeah. If you have really bad lupus, then yeah, you're fucked.
But we do a lot of things to try and manage it. And there's things that we can use, there's things that we try and avoid using, but are not known to cause issues or not suspected to cause issues, but we try and avoid those because we try and use the things that are proven not to cause issues.
Right.
And
then is that a very high probability that lupus is transferred to the baby?
If both parents have lupus, yes.
Right, dominant or whatever.
Yes, but because it's suspected to be more recessive.
I know my Lamarck squares.
One of the medications we use for suppressing the immune system in pregnant women, and I'm actually on this anyway because it's also used normally to treat lupus because it's very effective.
Okay.
It's called prednisone steroid.
Oh, I know about prednisone. I've taken prednisone.
It's used in a lot of
given dogs
inflammation
prednisone.
problems and rheumatological issues.
Okay, yeah.
It's not an expensive medication either.
Which is why we use it for dogs.
Yes. It's got quite a few side effects that it can have. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17,
How do you
18,
feel
19,
about
20.
these crazy side effect lists on medications? Are you still counting?
36, 37, 38, 39, 40, 41, 42.
Okay, like what? I don't remember this many on the commercial.
63. No, 65.
That's
66, 67. 68,
Are more being
69,
reported at the moment?
70, 71. There we go.
More are coming
I didn't
in
scroll all the way
second.
down. I didn't scroll all the way down. Sorry.
What the
that.
holy
There's
fuck?
71. But a lot of them are extremely rare.
What is the medication with the least amount of side effects? Sand? Fingernails?
I don't think there is a medication with the least amount of side effects. I think there's a whole bunch that are like Thai.
I want you to start paying attention when you pull up medications and find me the champion that has the least.
Okay, let me try and pull up the medication list and see if I can sort by number of side effects.
Oh, hell yeah. Okay, I have a moral question for you while you do this.
Okay.
Do you think it's morally responsible for people who have lots of illnesses to have children?
That's a difficult one.
Okay, by the way, Chad is guessing saline. I think C is a pretty good guess. Weed and Tylenol. Acetaminophen? Yeah. Ibuprofen. We might be in there. I like saline a
Doesn't
lot.
let me sort it, but I would probably say saline.
Has the most medical uses, least side effects.
Yeah. And I don't think you get someone allergic to saline.
Shit.
Wait, do you?
They're gonna have to have a very special bracelet on.
Allergic
To saline. Someone is. You know someone out there is. Or at least they have psychosomatically convinced themselves they are.
Oh, shit. Yes, there's people allergic to this too.
Well, you better ask next time you're about to use it. Sir or ma'am, do you have a known
I've never
saline
even heard of
allergy?
this, and I've been in, med school for what? 5 years now?
Okay,
No,
so
6 years. 2 years, then 3, 4 for residency. 6.
I know I don't want to have children because I have so many issues and so many issues that I have run on both my family sides. I would love to make a baby, but I feel like it isn't. But feel like it is very irresponsible.
So my issue with answering this question is I have a lot of health issues.
Yeah, you do.
But I still want kids.
Do you think, and that's fine. You smoke and you shouldn't. Like, okay, fuck it. But do you think, what would you suggest to someone, like I have Ehlers-Danlos, I've come into you and I've said, doctor, do you think I should have a kid?
Okay, what we can do to reduce the risk
Okay.
is
So that's immediately the angle we're going to come at it. Is just like, I'm not going to answer whether you should or shouldn't. What we can do to reduce the risk.
what we do is every time you're gonna before you start dating a girl,
Mm-hmm.
you bring her in, right?
All right.
And we start doing genetic tests.
Right. And we find someone who shows no markers.
No markers. Then we give you permission to procreate.
Then and only then. I like it. I'm gonna start Gattaca-ing all my girlfriends and being like, you need to spit in this vial. We're sending your shit to 23andMe, bitch. I can't.
No, 23andMe doesn't do it accurately enough.
No?
You want to send it to a proper laboratory, which is able to do a complete genetic panel.
I need to get a copy of whatever they did for my genetic panel. They said they only tested for 15 different markers, though.
Okay, that's not a complete genetic panel.
Yeah, that was like...
A complete genetic panel tests for, I think it's the 400 most common genetic disorders.
Okay, that's pretty good. That's a start. I'm
but
guessing
it varies
my
depending
15
on country.
Probably weren't on that list of most common, and that's why they had to do a specific one for the 15 I might have.
Yeah, but generally they first do a complete panel.
They did not. Hey,
but also,
I have a doctor's appointment
sometimes
tomorrow.
they don't do a complete panel because what happens is let's say I take 10 patients and I chuck them through an x-ray machine.
Right.
I'm more than likely going to find something on one of those x-rays.
Right.
But the person that I find it on is going to not be complaining of anything.
And letting them know. But I guess it depends
No,
on
the
what it
thing is,
is.
we find it, we need to treat it.
Right, yeah, depending on what it is. Now, we can't let you just walk out of here with that thing in your chest.
But the
With
point is,
DNA,
we don't go and dig for something. We don't just go randomly digging holes. We look at symptoms, we look at vitals, we strategically look so that we don't get an what's abnormal for normal,
okay,
but normal for you, and then we land up treating that.
right. Genetics is interesting. So,
Hold on, I just need to sign a script quickly. Prescription.
cool.
Please bring me another coffee when you take this out.
And some pizza and chips, which could mean cookies or chips. Either way, do you guys call them
Bring me the
chips?
patient's file. I don't know why they're trying to prescribe fentanyl.
Whoa,
Okay.
prescribing fentanyl?
Where
That's
were we?
talking about why people get full DNA panels versus specific ones. But okay,
Okay, so you want to try and not just randomly dig because you're gonna find something.
yeah,
And
if you do the
just because
400
you
most
find
common, you're
something
probably
doesn't mean
gonna.
it needs to be treated.
Okay,
If there's no clinical symptoms,
right.
you don't want to treat it necessarily.
But then in the case where someone comes to you saying something's wrong and you go looking, there probably is something that you're going to find.
Yeah, but also if they're complaining of it, it's causing an issue. Then you
Right,
fix it.
right.
But if it's not causing an issue,
You just let them
you
keep
don't want to
running.
find it and fix it.
I mean, you do. You just don't want to find it because then you have to fix it.
Yeah.
Okay.
In a lot of countries, especially in America, I think you've got to fix a lot more. Here we've got a bit more leeway.
Yeah, if they found anything, it would be their ass. If anything happened to me because of that thing they ignored.
Uh,
So I have a doctor's appointment tomorrow,
okay.
and I was going to ask him for a referral to a gastroentomologist.
Gastroenterologist, yeah.
Enterologist, okay. Um, just for shits and giggles, right? Just be like, hey, I've had issues my whole life. I should get this checked out. Or is there anything I need to like say to this fool to get him to do this?
How comfortable are you with a prostate exam?
Fine.
Okay, so you've had bleeding.
Okay.
And hope he doesn't have big fingers.
Wait, they'll give me one on the spot?
Yeah.
Oh, and then they won't find bleeding, of course. And then I'll
Yeah, and
then they'll say he's off to
then
a.
they should send you off for a camera.
All right. So this is the nuclear option. That's what I'm going to call that one.
But you're overdue for a colonoscopy anyway, so
It's true. So like,
especially with Elos Danos.
god damn it. I'm just going to have to suck it up and do this because it's going to be the best for me
I'll
anyway.
tell you this, they give you such a nice anesthetic for
For the
a
other?
colonoscopy
Okay.
that when you wake up, you feel like you've had a nice, like, proper sleep.
That would be nice. That would be nice. So I have to go because I need referrals for like that. I actually need it for psychiatry, and then I have to go to pain management because this fool's not going to give me any more. He's not going to give me amitriptyline, and he's not going to give me pregabalin. He's like, oh, those are serious. We need to send you off to pain management for those. So off I go. And I got the number
Okay,
for
that's
that.
weird. I've prescribed I prescribe medication that you normally go to a pain management specialist for, but
Yeah,
as a surgeon, I'm allowed to prescribe that.
right. I've had doctors prescribe these things to me, so this is just a him thing. This is my new general practitioner. And today I called. You go on the insurance company's website, right? And you're like, what's the list of practitioners in my area? And the insurance company's website will tell you a list of practitioners. You call someone on the list and they go, what insurance do you have? You go, I have Banner. That's how I found you. And they go, huh, interesting, because we don't accept your insurance. So this happened to me 3 times today before I just said, fuck it. I'm going back to the doctor I found and didn't like. So here I am.
Okay, I'm thinking there's any classes of drugs that you should maybe ask the pain management guy to try or this doctor to try.
So
Um,
I use
have you tried anticonvulsants?
no. I don't think I have.
Okay,
So are those good
write that
for
one down.
yeah, I'm writing it on a notepad. What
They have some effects. They have some positive effects on treating pain. Um, non-steroid anti-inflammatory drugs,
yeah, NA
NSAID.
yep, yep, NSAID. And what was the one low dose naltrexone?
Low dose. What was it? Low dose.
Naltrexone. NALTR.
No, not naltrexone. It was something else.
Oh, you're thinking something else? Okay.
Yeah.
Low dose.
Let me see. I think it was on my. I think I've got it under a list.
NSAID, is
I think I
that
saved it somewhere.
naproxen?
That's things like. What's a good one?
Well, let me see what naproxen is.
Paracetamol.
Oh, you kind of cut out there.
That's a weak one.
Oh, I see. Okay. Yeah, it is
There's a
non-steroidal
lot stronger
anti-inflammatory.
ones.
Okay.
Um,
NSAID is like Tylenol. They're saying. Okay. Yeah, yeah. Ibuprofen, naproxen. Right. All right. That's apparently the weak ass shit. Yeah, I had been suggested low dose naltrexone. No, I think I read about low dose naltrexone.
low dose methotrexate.
Methotrexate. That sounds intense.
Yeah, that chemo drug.
Oh, cool. All right. Well, you do what you got to do.
Because do you have any arthritis type
All the
symptoms?
fucking time. All my joints hurt.
Low dose methotrexate would help with that.
Okay.
You're just gonna have a permanent mark if you don't move injection sites.
Okay. Interesting.
So
So
it
it's
might
something they
look
would
like
have to
you've
inject me
been
with.
spanked extremely hard.
So it's something they have to do injections of.
You have to do injections of.
Oh, I see. I see.
I suggest a mirror because it's a bit difficult to see your ass without one.
Right. Well, I have a hairy ass. It's a bit difficult to see with a mirror. Okay. So I have here to tell the doctor that I have anal bleeding and to ask about low dose methotrexate. Good notes. Good notes. I'm happy we've had this talk.
Okay. I had some more notes here on the EDS that I wanted to ask you
Ooh,
to try
fancy.
and get.
Yeah.
Modafinil.
Modafinil. Yep.
Yeah. Um,
Yeah, that would be fucking good.
have you tried? These are the less How would you describe it? Like you don't want these.
They're too hardcore. They're too intense.
The little more aggressive treatments.
Oh, that sounds...
Have you tried joint debridement?
No. What is that?
It's a surgical procedure on your joint.
Oh, well, none of the surgeons wanted to touch me.
Okay. Um, Tendon replacements?
No. That's obviously more surgery.
Yeah.
Look these up at least. Joint.
The other thing that, if it gets really bad, that we could do is joint replacements.
Hmm.
Not the most pleasant thing to go through.
Yeah, it doesn't seem that way.
Because we literally cut part of your bone off.
Ow. Yeah, and just swap it with someone else's fucking bone?
No, we put a metal one in.
Oh,
Or
that part
silicone
sounds
or
fucking
ceramic
cool.
or...
If you can promise me steel, I'm in.
We don't use steel.
Can you promise me something hard enough to break noses?
How are you going to break noses with something that goes into a socket like your hip?
Oh, I thought this replaced my joint. I thought that like
Just
the
the
whole
joint.
hard part. I thought the
No,
whole
it's
hard part of
just
the
the
elbow
ball.
could be
The
like...
ball part of the joint. The thing that goes into the socket.
Oh, that's not as fun. Fine. Something cushiony then.
No, we use something hard.
Really? Oh, okay.
Yeah. Because we want it to be something hard that's smooth to reduce friction.
Okay. I see, because it has to act as the pivot for the socket.
Yes.
So these are obviously things that are probably not necessary now, but maybe down the road for joint
Yeah, but one of the most common materials you might like is we use titanium.
Yes.
And we can even do it to your fingers. That's
Oh,
how.
okay. Titanium fingers. Okay, more things to ask the doctor to talk about tomorrow. Okay, and my South African doctor had me ask you about titanium finger replacement surgery? And anal
It's for the
bleeding.
finger joints. The finger joints, not the entire finger. So your
Titanium
knuckle.
fingers. 100%.
Titanium knuckles.
Where are you at on cybernetic replacements?
Well, after I finish medical school, I'm going to be going back to university.
Okay. To learn about cybernetics?
For computer science and robotics.
Yes. This is what we need. This is what we
Because
truly
I've already
need.
got a minor in computer science.
Mm-hmm.
So I'm going to convert it to a major and do a completely different degree.
Cool.
Well, 2.
Right, a second degree.
So it'll be 3 degrees in
Oh, you have
total.
3. Okay.
And then on top of that, during that time, I'll be doing my specializations.
Which will be for emergency?
Yeah, emergency med, trauma surgery, transplant surgery.
So you'll be the guy emergency transplanting cybernetic arms one day, hopefully. like when I come in from the car crash, it'll be like, we can rebuild him.
I'm thinking more like replacing my own kidney.
Yeah, that'd be
with
good.
like an artificial one. I don't know if I can do the surgery myself, but
if you can design the kidney, you can have it put in. I
just don't know which doctor I would get to do that.
I'd like a replacement stomach that can digest, whatever. So that way I don't ever want indigestion again. is what I'm saying. I want to eat hot wings and not shit fire.
Thank you. Okay.
Modafinil, I'm actually going to ask about.
Okay, this fentanyl is getting cancelled.
Oh, yeah. What the fuck?
He's trying to give fentanyl for someone who's got a headache.
That's a little extreme. I went in with the first migraine I'd ever had in my life, and they gave me morphine. Then they gave me Dilaudid. That didn't work either. So then they gave me caffeine and Benadryl, and then
Yeah,
my fucking
caffeine
headache
is
was
one of
gone.
the best treatments for it, actually.
The fact that they didn't try that before morphine is kind of interesting to me, but they didn't.
Tell
Morphine,
David to
Dilaudid.
come to my office after shift.
Ooh, David's in trouble.
Yeah, there's a script. We call the prescription scripts here.
Yeah, we call them
It's easier.
scripts.
Okay. So you could look at those, but I would say try and stay away from surgical approaches as much as possible. Those are only last resorts.
So compare like methotrexate to a surgery. What is really worse for
I would,
you here?
I would rather take the methotrexate.
Okay. So you're saying that damaging your body with chemicals is probably better than damaging it with steel
Well,
and lasers?
remember, we're talking about joint replacements. That is a long recovery.
So the recovery is the issue, not the surgery.
You are going to be sore for a very long time.
And then you're going to baby that muscle.
And then you've got to go through rehabilitation for that muscle.
Yep.
And methotrexate isn't that bad. I've been on it for 18 months in total.
Okay. And you haven't really seen much for side effects?
The cyclophosphamide gave me a lot of side effects. The methotrexate, not so much.
Okay.
Like, I haven't even lost my hair on the methotrexate.
Good to know. I would be upset to lose my hair.
Like, the cyclophosphamide, I lost my hair.
Gotcha.
But because of the prednisone, is what I think. But my beard didn't fall off.
Like a proud dwarf.
I'm a bit tall for a dwarf, but okay.
That's incredible.
So that stayed. And then when I went off the cyclophosphamide back onto the methotrexate, the beard just like doubled.
So it was like it wasn't growing at full speed, but
Yeah, and then it just went into like hyperdrive.
and the rest of your hair started coming back.
Yeah,
Now, what about like other body hair?
no issue with that.
Okay. Interesting.
The nice thing with the cyclophosphamide though is it's quite a good birth control for men.
Really? That's good to know. Just kills. I actually did see something in the side effects in there about sperm.
Yeah, they're not effective at all on cyclophosphamide.
Get all fucked up. I want to see a bunch of sperm swimming sideways and shit because they're all fucked up on meds.
They don't even swim.
Aw, poor little idiots.
They're worse than idiots. Like if they try to swim, they would swim in the wrong direction.
That's great. So these things returned somewhat to normal when you went off that med?
Completely. As soon as I was off it, I was back to normal.
It's
But
good
the
to know.
problem with cyclophosphamide is depending on the number of doses you go for,
Mhm.
if you go for a certain number of doses, I can't remember, but there's an average number of doses that if you go for, you permanently sterile.
Whoa. Okay. Interesting.
So I was only on it for 3 months,
Do you know what
which
that range
was 3
is?
doses. Let me check.
I'm asking for a friend.
Oh, you want to go on this just for that? Okay.
It sounds more comfortable than what's the fucking surgery called? What is it called? A
Okay,
vasectomy.
so there's no numbers that I've been able to find. It's just
Oh, okay.
the more doses you go for, the higher the chance.
Got it. Got it.
So
Interesting that that is the permanent effect, and and that they haven't really said that there's any others.
but there are drugs that women can take which can prevent them from becoming sterile.
But men, not so much.
Yeah,
Huh.
but with men, there's like nothing. I haven't
Interesting.
heard of anything and found any research.
That's very strange.
But it's an extremely like you would. I started feeling side effects of cyclophosphamide within 20 minutes of the IV starting.
Oh wow. That's fucking quick. What did you feel?
Nausea, dizziness, and then I would be complaining, and then they would knock me out.
Oh wow. That's pretty intense.
No, I signed this prescription.
Well, that's okay. I see. So they knocked you
And
out
then
with
I
something
wrote the
else.
prescription, then sent it to another doctor. Doctor read it, was like, okay, writes me my own script.
That's pretty. So you get to practice medicine on yourself then.
Not really. He had to approve it,
Okay,
and
but
he had to write a script. I just sent him a prescription suggestion.
you can do that as much as you want for yourself and like advocate for your own health in that way.
Well, we can recommend to a doctor the medication we want, and they will take our recommendation more seriously because we've been through med school.
Right. Like I can't go to my doctor with a list of recommendations for him to prescribe to me. He's going to be very offended.
Yeah, not really that, but if you go to him with a list of recommendations for painkillers, he's going to think you're an addict
That too. But a lot of things
very
that,
quickly.
yeah, that's true. I mean, things I'm asking for are really not that motherfucker. And I did. I was like, are people really abusing pregabalin? And he's like, well, it can lead to euphoria if it's taken in a high enough dose. Like, what?
I've never heard of that being used recreationally, to be honest.
Ever. No one. I'm like, what? In your entire time in med school, did you ever run into a student that was like, psst, want to buy some pregabalin? Like, when did this happen to you? And he's like, well, I'd just rather you see pain specialist. Like, fucking, all right, I guess. But when I go in to see them, anyone with half of a fucking lizard brain left, I'm going to be like, I've been on pregabalin and amitriptyline. And they're going to go, oh, okay. That's not pain addict requests.
Yeah, so I'm just rewriting David's prescription here, and I'm swapping out fentanyl for paracetamol.
Okay.
I think that's more reasonable for a headache.
Yes. I've taken that. You say you have. Okay. One of my friends is saying they've seen it happen. People taking pregabalin, but it's incredibly rare and there's really not much rec effects from it. They were stupid, and I hate them because they ruined my life. The one person on earth who's done it for recreational purposes has caused me so much strife.
And then I'll give them full still pain. There
Okay.
we go.
Skull pain.
So still pain is a mixture of codeine and paracetamol.
Okay, that sounds pretty nice.
So I give for a headache, I'll give them quite a bit of paracetamol, and then I'll give them like 4 tablets of still pain
Yeah.
in case the paracetamol doesn't work. But I'm not gonna give them frickin' fentanyl. What's this
Yeah,
idiot
no.
thinking?
No. This is how this happened.
This is how we got a drug problem in the first place.
Yeah, this is what. Come on, guy. Or nerve pain in my jaws. It was good for pain management, but I don't see what kind of dumbass would think it's recreational. Yeah, true. Like, it doesn't. It's like if you don't have nerve pain, it doesn't even do anything. Like, you don't even feel anything when you do have nerve pain aside from not nerve pain. Like, there's no, like, oh, I feel so fucked up on painkillers right now feeling to that one. So, I don't know. I had fun with oxycodone, but that was oxycodone.
Yeah.
I take tramadol, and like that I can maybe kind of feel if I take a bunch of them, but the pain relief effects happen so much before I feel it that I don't feel like I'm abusing it. I'm like, I'm
So
not doing this to feel it. I'm doing this to.
the painkillers that I have prescribed now, I had no influence on these.
Yeah.
These are prescribed by my doctor for the lupus.
Mm-hmm.
I have access to paracetamol, still pain, tramadol, Pelexia, morphine.
I don't know what Alexia is.
Let me check what the American version is.
Yeah.
It's a pentadol.
Pentanol. Pentanol. Just not something really popular.
It's a good one though.
I'm gonna ask for that next time.
Now, this is a medication which is between tramadol and morphine.
Okay.
So it's less addictive than the morphine, but it's more powerful than the tramadol. But it's then again more addictive than the tramadol.
Okay.
But
I mean that makes sense.
like I've got morphine tablets sitting at home. I don't use them. I haven't used them since I got out of hospital last year.
Okay.
I've got them, but it doesn't mean I'm going to use them.
Yeah.
So if you get a medication that's a painkiller, save it for when you need it.
Yeah. Yeah, that's a lesson I didn't know when I was younger, and I would just like be like, well, I guess I'll just take more of them for fun because I don't need it. Now I'm like, you better fucking you gonna eat that? I'm gonna fucking save that shit for winter.
And if you have a script for it,
As the
collect
serotonin
the painkillers even if you don't need them and keep them.
right.
And
Yeah.
then if they expire, take them to the pharmacy, give them to the pharmacist, and they'll dispose of them safely. But don't throw them in the dustbin.
Yeah, no, animals get those.
Okay, well, in South Africa, we're more worried about the people getting them.
Digging through your trash and finding prescriptions, I could see that. I could see that. That'd be a good clue as to who to rob because they're probably old people.
No, there's literally entire communities that live near the garbage dumps,
Oh
and that's where they
shit.
get everything they need.
Damn. Yeah, we don't have that. We don't have that. We just have burglars.
So I dispose of all my needles at the hospital.
Yeah.
Take all of them from home. take them to the hospital, take all my meds to the hospital, dispose of them safely there.
Yeah.
In one of the yellow bins, gets incinerated, perfectly fine.
We're supposed to take ours to the pharmacy.
Or just walk into a hospital, walk into a ward, find one of the boxes, chuck it in there.
Yeah.
Because some countries, the pharmacies charge to dispose of it.
Yeah. Yeah, anytime someone tries to charge to dispose of trash, that becomes trash very quickly.
Yeah. And it's kind of pointless because now you're causing the issue you're trying to solve.
Yep. Yep.
But there's a big issue in a lot of countries where there's irresponsible disposal of medical waste.
I could see that. Like as a almost political failing.
Yeah, like I can't remember which country it was. They were throwing organs into the normal trash.
Oh fuck shit. The diseases.
Like, no.
God damn.
But yeah,
But if you
what
haven't
else do you
outfitted
want to know?
your hospitals with adequate equipment to get rid of that shit. What else is there to know about South Africa?
We don't have lions running in the streets like most people think.
No, you know what we all think of it now is that it's just like a big drug war that never stops between a bunch of African warlords who
No,
all have child soldiers sniffing a mixture of gunpowder and cocaine out of tobacco leaves.
that's more north.
Okay, okay, that's the
More
Congo?
central, northern Africa, yeah. Wait, let me find you this video.
A video.
Olja gives monkey AK.
Oh no.
Let me find this.
What percentage people there are white versus black?
There you go. I sent it to you on Discord.
Okay.
Check how stupid these guys are.
Like, are you a minority there?
Yes.
Okay.
Check that video on your stream. It might entertain a few
I'm
people.
frozen. I'm working on it. It's gonna be on there in a second. It clearly is very funny. God damn it, Discord.
It's only 42 seconds.
Discord is taking a shit on itself. Okay, wow. Discord, I appreciate your effort.
I'll chuck it into the stream chat and grab it from there.
Yeah, do that. I don't know how much of that is real, Churro, and how much of that was just Metal Gear Solid. Oh, now we're clear. Cool. Come on. Go. If these people DMCA me for this fucking clip, I'm gonna be so mad. Yeah, you never know, Churro. You never know how much is real and how much is just like, what?
Mo talaga bien. Hey, Lenny, beaucoup de gens bàyyi dof dof ñu gën a bàyyi. Hey, beaucoup. Non, 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 non.
No, 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 no.
Doomu la rey leen jël bu jëpp sala.
No, 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 no. Yep. Yep. Now we're rethinking some stuff. Now we're rethinking some of our life decisions. Yeah, he's like, hell yeah, look at me. I'm king. I'm King Big Dick on campus. God damn. Everyone's having fun, and then they're like, oh. They fire yourself like 2 rounds, and they're like, oh shit. We've made a bad decision.
Yeah, they're not the smartest people I've seen on YouTube.
Well, they're not paid to be smart, okay? They're paid to hold those guns and look like tough guys.
Those are actually rebels.
Are they?
Yep.
I mean, what's a rebel?
They're going against the government there.
Is that a good thing or a bad thing?
I don't pay a lot of attention to that.
Yeah,
I pay more attention to medicine.
I don't know who's a good guy and a bad guy anymore.
Also, I don't really think in that way because if I get someone in the ER, I don't care who they are, to be honest.
That's fair. Like the old, if Hitler comes in on the gurney, are you gonna kill him while he's on the table, or are you gonna let him die, or are you gonna do your best to save him?
Yeah. It's not my choice on whether he should live or die.
Yep. That's my answer to the trolley problem, is I don't touch the lever because that's not my decision.
I'm not paid to make that choice.
Yep.
Didn't get the job to make that choice.
I didn't sign up for this. I did not sign up for that. You signed up to heal people.
Yeah, regardless of who they are.
Yep.
Doesn't mean you don't want to save the guy. It just means you put that in a box and don't look at it.
Right. You just, and and that's the whole thing. You're not a judge. You're not an executioner. You're not there for that. Like, if they're a criminal, then they should be brought back to health so that they can face trial for their crime or whatever.
Yeah.
I agree.
That's someone else's wheelhouse, not mine.
Yeah, that's someone has studied law their whole life can handle them now.
Yeah, someone who chose to do that.
How do you feel about lawyers?
Depends.
Depends on if they're defending you or prosecuting you.
Yeah.
Yep.
And it depends if it's one of those lawyers who's fighting for stupid shit with regards to medicine.
I see. Like what?
Like charging people who are drug addicts instead of treating them.
Yeah. I know what you're talking. Like when they fight for the various drug companies.
Yeah.
Yep.
And the ones that have gone in some countries and made it legal for medical companies to advertise directly to doctors.
Yes.
Which is complete bullshit.
Yes. We have an
That's why I don't speak to them at all.
It's so fucked up. And like, how are you not supposed to be influenced by that? Like, even you, are you not now influenced to be disfavorable towards those companies?
No, I just ignore them.
Yeah, it's the only correct answer.
So I don't let them speak to me about the medication because I'll look at the research.
Yeah.
But I won't look at their research. I'll look at the independent research.
Don't worry, we have plenty of research for you to look at.
Yeah, I don't want them to go and cherry pick the research I'm reading.
Because they definitely will.
Yeah.
Not going to
And
knock on
that
your
is,
door and be like, yeah, we often fail.
yeah, like if they come and knock on my office door, they get chased away. Simple.
Are there a
Don't
lot of
come
them?
back. Well, they've stopped coming to my office.
Do you see them going to other offices?
Not really. My hospital doesn't like them at all.
That's good. So they've created a good culture that's kind of oppositional to them.
Yeah, and it's not even hospital policy. It's doctors doing it themselves.
Right. That's cool.
They get chased out by the doctor's assistants or the doctor themselves.
It sounds in a lot of ways like you guys have a little bit better of a system going on than we do. Which is not, generally what you think, but America's pretty low on the list.
Remember, I'm in a private academic.
Yeah, but we even have those, and they still suck.
Yeah, but our government hospitals are incredibly bad.
Okay, so the difference between the two is a lot worse?
We've had nurses and people go on strike and then go and interrupt surgeries.
Yikes. That's a little spooky.
Like the guy's having heart surgery and now there's people in the operating room striking.
Oof.
Not a very good environment to be performing a surgery.
No.
First of all, it becomes unsterile very quickly.
Yes.
Because if you're striking, you're not going to go through the whole sanitizing process.
Okay, so when you're sanitizing, obviously you want everything to be as sanitary as possible because, just period.
Yeah.
Now, let's say that we start dirtying up the room a little bit. At what point do you feel like the patient is in actual risk for infection because of the room itself?
As soon as sanitization is broken,
Yeah.
surgery has to be stopped.
I mean, obviously there are people who survived war surgery in the fucking 1800s, so it's not entirely true.
But that is regulation
Right.
today.
I'm just wondering.
As soon as the sterile field has been broken, that surgery is immediately stopped.
Okay.
If you break sanitization without breaking the sanitization field, the sterile field,
Okay.
you immediately leave the operating room, re-scrub, come back in.
Okay. That makes sense. And the sterile field is what? How much distance?
That all depends on the type of surgery and what is happening in that actual operation.
Okay.
It's more about making sure that the area on the patient is sterile
Mm-hmm.
and all the equipment going into the patient is sterile and an area around that is sterile.
So that nobody's
And then
kicking up any
all
garbage that's
of
landing on it.
mainly your arms and upper torso need to be sterile.
Okay. So yeah, anything
Because
that's touching the patient are going to be
if your
touching
foot becomes unsterile, it's not really going to get into the sterile field.
Okay. Yeah.
Because I've never heard of a surgeon using their foot to perform surgery.
And that's more in the range of what I was actually talking about, is where is the actual danger. So it sounds like it is pretty much proximal to the wound and the opening and like touch.
Yeah.
Okay. And then everything beyond that is obviously, good. Just sterilize everything outside of that because, period. But that's
So when you look at the patient on the table,
mm-hmm.
from a point upwards on the table, if you're looking vertically,
Yep.
is sterile.
Right. Okay.
From about the waist to just, I would say about 5 centimeters, 4 centimeters below the neck
Mhm.
of the surgeon, and then the arms has to be sterile.
Okay.
And let me see if I can find a diagram.
This is Nick Aikakun. This is our doctor comrade.
Okay,
Nick
so there we
Zassa.
go. I'll put it into the Twitch
Okay.
chat because your Discord's giving
Sterile
issues.
field. Okay.
I'm trying to find the basic images so they're easier to understand.
Yeah, this makes sense. This makes sense.
They're a
It's
bit
almost like,
oversimplified,
yeah, you could
but
beam light out of the patient in all directions and be like, that's pretty much,
sterile.
yep.
And then there's the surgeon. And then of course all your equipment.
Right.
So you don't drop your arms below that vertical point on the other diagram and
Right.
this diagram,
Right.
because the air there is technically not sterile
Since all
and generally
debris
isn't.
is going to fall, then the higher up the thing, the more sterile it is.
And also we generally blow air down,
Right.
clean air down,
Okay.
not like forcefully. It's because if we do that, then something can blow into the
Right. But that's just how
incision,
air
which we don't
currents
want.
end up working anyway. That's
Yeah.
so
But as
how.
soon as that field is broken,
Mhm.
the surgery has to stop.
Okay.
And that is to protect the patient, the hospital, and the surgeons,
Makes sense.
because all three have problems if that field is broken and the surgery proceeds.
Right.
The patient can get an infection, the surgeon and the hospital can get sued.
Yes. So how often do you perform surgery?
It really depends. I do a lot more surgery because I'm a surgical resident,
Mhm.
but I would say, let me see. Let's see what my last week was like. Where's the portal? So we've got a web portal that's on the intranet in the hospital where everything we do gets logged.
You can
So
check
if I
your own
prescribe a
stats.
medication, it gets logged there.
Okay.
Okay, so Monday. Monday, Tuesday, Wednesday, Thursday. I've done 11 since Monday.
Whew. Yikes. So sometimes multiple per day. Then.
Yeah, when was this? Tuesday, I had 5.
Dang. How many hours did you work that day?
24.
Ooh.
And I had the migraine on Monday.
Right. So what is that like having to go in there
Well,
like
Sunday,
tired?
I had the migraine. Then Monday, then I came in on the. I drink a lot of coffee and a lot of energy drinks,
Right.
and you learn to nap efficiently.
Okay. You have to really pack in sleep when you can get it.
Yeah, like because our circadian rhythm is messed up,
Right.
obviously.
Yeah.
What we do is a lot of us are able to actually take a 2 hour sleep, but that 2 hour sleep will go into a very deep sleep,
Right.
where most people won't go into a deep sleep for at least an hour and a half.
Right. How do you learn this technique?
I have no idea. My body just did it.
You just become exhausted and pass out. Cool.
Yeah, but then when you wake up, you feel like you've slept.
God damn.
I guess it's not a fast way to die. we have to find a way to get energy.
Yeah.
Some
Apparently.
doctors actually use oxygen.
Well, have you ever tried it?
I don't like it because I get a bit lightheaded.
Yeah. Anytime I've ever done it, I've gotten lightheaded.
But funny enough, if I go for an MRI, I'm not normally claustrophobic. But
Right.
when I'm in an MRI, I am.
That's weird.
But if they put oxygen
Oh.
and they put it on the
Prevent.
highest flow rate, I do not get
Claustrophobic.
claustrophobic.
I actually have a very similar issue. My issue with claustrophobia is the air becoming still. Power naps between 15 and 20 hours. Your body knows it has minimal time to get the premium sleep, so it skips the foreplay and hits the sweet brain spot. Why were you
It's
in
the
an
first time I
MRI?
actually modded a message.
Congratulations.
So I see Kat is gonna get the same issue as me if he or she continues typing like that.
Yes. Any medical speak immediately gets you fucking. What was even the
Botted.
issue? Oh, foreplay. Got it.
Yeah, but
Foreplay hadn't been improved yet?
what was my one? Stroke.
Stroke. Stroke you. Stroke you.
I said if you were having a stroke, you'd know.
Yes. Permitted.
You would know.
Stroke you.
And bang. The bot is like, no, I don't like you, Nick.
You know, inevitably, through all the added terms, it should get there to where it just doesn't do this all the time, but like, I don't know. We put it through the ringer.
I think I will train it for you.
Fuck.
But there's a lot of things that doctors try and things like what's it called? The key technique. So get doctors that'll rest in a chair and they'll hold keys in their hand. And then as soon as they fall asleep, they drop the keys,
It wakes them
which
up.
wakes them up. And some doctors use that the whole time, and that apparently keeps them rested. I don't
Resets the
know. I've
brain.
never tried it. Don't plan on trying it. It doesn't sound like it would work for me.
That's so weird.
I was in an MRI because I was having seizures.
What did they find?
They don't know why, but I am having epileptic seizures. They suspect it's from the lupus, and so do I. But I haven't had a seizure in 3 months, 4 months.
Yeah, cool. Do you just start having seizures for the first time in your life at that period?
Yeah.
Damn.
Well, I had a seizure about 2 years before that.
What was your first seizure like?
Well, I had been drinking for 3 days and hadn't slept.
Yikes. So how did you know you were having a seizure?
I didn't know I had the seizure. My friends woke me up with paramedics there, and they were like, "Hey, you had a seizure." And I was like, "Really? Okay."
Huh.
And then they wanted to take me to the hospital. And I was like, "Nah, I'm fine." So then I went and slept I took a sleeping pill.
Yeah.
Which is supposed to knock me out for 8 hours. I slept for 3.
Oof.
And then woke up and then back to the bar.
Damn, dude. What are you trying to do to yourself? Was this what you were in med school?
I was actually at a charity conference.
Shit.
It was a 4-day charity conference.
Is that same charity?
Yeah.
So you've been involved with them for a long time then?
Yeah, so I started drinking on the Thursday before I arrived at the conference. Then I arrived on the Friday, carried on drinking, stopped drinking at 5:30 in the morning, 6:30. Yeah, 6:30 on the Saturday morning. Had the seizure just before 12 on the Saturday afternoon.
Okay.
During the meeting. Got excused from the meeting because I had the seizure.
Right.
Slept for 3 hours. Woke up. It's about 4:00 in the afternoon. Go straight back to the bar and carry on partying until Sunday.
No more seizures.
No more seizure. Then 2 years later, bang.
Damn.
And I realized I had a seizure because I woke up in the bathroom on the floor and there was blood everywhere.
Yo, yeah, that's spooky.
So I had a seizure and hit my head on the basin.
Ouch. Is anybody home?
I'm not an alcoholic, don't worry. I don't have that amount of time to drink, so that when I get a chance,
You go hard.
Yeah.
It's true. He doesn't take much time off. He can't party often. I've heard.
Let me check how much leave I've got now built up.
Oh yeah, you said like 120 days. Something.
Yeah, but they give you time off for when you work overtime.
Oh.
And I've taken 3 days since in that time. Well, 2.5. Well, no. 2 days. Yeah, 2 days. I'm at 131 days.
God damn. That's just ridiculous. You need to go see the world. Go and travel.
What? Go and see the monkey with the AK?
Yes. Go and look at him. He's there
and
waiting.
Patch up myself after I get shot, or patch up the guys around me.
Yep. Doctor's on tour. You don't want to travel.
Okay, the way I had the distance that I felt was way too short to have damaged my spine.
Hey, do you know who Harvey Weinstein is? Not Harvey Weinstein. Yeah, wait. Not Harvey Weinstein. Who didn't kill himself? God damn it.
What, do you mean that guy that was Superman?
Yes, the guy who broke his own neck in prison. Epstein. Fucking Epstein.
In prison, or the guy that fell off his horse who was Superman?
No, this is... Okay, then you don't know about him. Epstein was this dude who was implicated in a bunch of pedophile sex rings.
Oh,
and he had the names of a bunch of people, and then he goes to prison.
That seizure was completely unexpected. I hadn't been drinking, had been sleeping, and it came out of nowhere. And then they found out I had epilepsy. So, well, we found out.
So here's my question. Do you think someone can break their neck using a bunk bed
Yes.
and some toilet paper?
Toilet paper, no, but I think you could do it just with a bunk bed.
With just the bunk bed?
Yeah.
Interesting. Okay.
You stand on top of the bunk bed and do a head dive.
Just face first, nose dive it. Okay.
No,
Or crane
you
your neck.
bend your head a little bit in and
Okay.
then do it.
He supposedly the only marks are around his neck.
What did he do? Like get
So
his head stuck in the bar
he took the
and
bed
then
sheet,
flip himself.
but the bed sheets are made of the same material that they put on top of toilet paper or like the toilet seat lids. You know what I'm talking about? Do you have that there?
No.
It's like a thin. We also use it on examination tables. It's really thin paper.
Oh, that stuff, yeah?
Okay, so that's what the blankets in this prison are made of. He took one,
How thick
wrapped
are
it-
they if you're going to do
he
that?
wrapped it around his. They're that thin because they didn't want people hanging themselves. He wrapped it around his neck, tied one end to the top of the bunk bed, and hung himself, quote unquote, in a way that caused the vertebrae on his neck to be crushed.
Okay. I still do not understand the logistics of how that would
Dude.
do that.
Yeah, that's the whole fucking point.
The only way I could see that happening is if he... Okay, so like, you know, if you take your head and you put your chin on your chest.
All right.
So like if you do that now.
Yeah.
Now, if you do that and then dive so that basically the center of the top of your head
Oh, okay.
hits the ground first,
Yeah,
then
no.
you could break your neck.
No, he didn't. He
Easily.
didn't face dive. He broke his neck through the choking mechanism.
To do that, you need to have a drop. A sufficient drop.
Yep. So if he stood on top of the bunk bed, I think the ceilings are only 10 feet tall. So if it's like 6 feet in the air or 5 feet in the air, I don't even think the ceilings are that tall, to be honest with you. I think they're like 8 feet tall. And then like just dropped himself sideways off the bunk bed. But it should
So
have...
the official table of drops. How much did this guy weigh roughly?
Fucking... How much did Epstein weigh? Jeffrey Epstein weight and height, because many people have done this now.
I
Where they're
just
like,
need his weight.
okay, I'm getting it.
I'm looking up the British official table of drops.
Okay, so I'm gonna have to convert this.
No, it can be in
Okay, pound.
stone, pounds, or kgs.
Stone.
Yeah, the stupid British way of measuring weight.
181.
181. Okay, so that's between 168 centimeters and 174. So let's call that 171. Roughly, then take off maybe 3.
This is the important bit, guys. This is the important part of the fucking interview.
1, 6, 8.
There's some of the notes from my doctor tomorrow.
So could he drop 5 feet 6 inches?
Yeah. Yeah, definitely.
As in, from the top of his head.
I'm thinking if he was on the top bunk squatting, and then jumped off, that would be more than 5 feet.
Okay. But remember how tall he is.
6 feet.
Add that to the floor height.
Oh. So he has to
Because the
fall
neck,
11 feet? Well, but I
where
guess
the
unless
rope
he's like
attaches to him,
laying on his
has to
side.
drop that distance.
Yeah, right? So if I'm squatting on top of the bed and now the rope is hanging below my neck, and then I jump off, but my neck would have to be right like a foot from the floor.
That won't work because the rest of his body would impact the
Right.
floor first, which softens the blow, which doesn't make it work.
Okay, yeah, so
So, Aiko, which country are you in?
this is in America. This is in Manhattan.
Ooh, medical school requirements. I'm not sure about America's requirements, but let me take a look.
This also happened in the 5-minute window between guards checking in his cell, by the way.
No.
I don't know how much the time crunch matters
So
to you
either
there.
one of the guards did it to him, or he did a head dive.
All right. That's where we're at.
Okay, so in America, you need to
Erica, yeah, is saying, what does it
qualify.
take to become a doctor? Sorry, Erica Ica is in the Caribbean.
Ica, sorry.
I didn't realize what
Caribbean.
you were asking for. There we go, yeah.
I do not know how it works in the Caribbean, but you're going to England. England, let's do that because that makes most. That
Yeah.
will be easier to find.
That'll be standardized.
Okay, so you need a high school diploma, good marks in biology, chemistry, physics, and maths, letters of recommendation, letter of motivation, volunteer or work experience related to healthcare.
That's to get accepted into medical school?
Yeah, then you need to be taking either International Baccalaureate Diploma, must offer 3 subjects in chemistry, biology at a higher level, plus 3 subjects at a standard level. Minimum, whatever the hell these are. I mean, Google what those are. Okay, so you need an IELTS score of 5. I'm not sure what. You need a minimum score for that.
A score on
Don't
something?
Yeah, I'm guessing it's a bit similar to the MCATs.
Okay.
Then
Or like our ACTs.
Then each year of medical school has different admission requirements. So just because you complete the first year
Really?
doesn't mean you get into the second year unless you meet the admission requirements. And then you go through 3 cycles. First cycle is 2 years. Second cycle is 4 years. Then you do 3 years for generalized medicine and 4 to 5 years total in the third cycle if you want to specialize.
What is the
So either do
cycles?
general medicine, which is 3 years, or you specialize, which is 4 to 5. So you don't do 7 to 8 in the third cycle. So that is 9 years minimum.
God damn.
Up to 11 years. And then if you want to do more than one specialty, you add 4 to 5 years for each specialty.
That's a lot of school.
So if you want to do a cardiac, that would take you. Cardiac is usually a long internship, so that would be 11 years.
From start to finish.
Yeah.
Damn. I guess get out of high school at 18, become a doctor at 29, or become a specialized doctor.
Yeah, I was quite lucky. I started in, what's it now? 2016, I started.
Okay.
And I did year 1 to 3 in 2 years.
Oh, that's nice.
No, yeah, 2 years. And then that brings me to 2018. And then I've been doing residency for 4 now, because those 2 years were combined into my residency because I was in an accelerated program.
Interesting. So you really accelerated yourself wherever you could.
Yeah.
I could see why you'd want to. Like, just be like, I want out.
I was supposed to finish high school in 2015.
Yeah.
I finished in 2013 and took a 2-year break.
Nice.
During residency, you do get paid, normally, depending on the country. And depending on if you are a standard resident or a chief resident. Chief residents get paid more. But chief residents work more hours and have a lot more responsibilities.
Makes sense.
Yeah, because you're running the rest of the residents.
Yeah.
Which is why I'm going to be speaking to David, the supporter of the opioid crisis.
Yes, that cursed David. All right.
But like you can look at accelerated programs.
Find more job paths. Well, it's not a bad idea to have a few in mind, that's for sure.
And also you can do what is referred to, there's 2 ways normally to get into medical school. Either you, depending on the country, here you can either get straight into medicine, which I did, or you can go through what's called the GEMPT, the Graduate Entry Medical Program. Now, in there, you have to complete a degree first. Then you then you have to have done 3 modules, which was a chemistry module, a biology module, 4 modules, a biology module, an anatomy module, and a calculus module. Then once you complete that, you then write a test, which covers the first 3 years of med school. And then you get admitted to the 3rd year of med school, 4th year. But you have to pass that thing with an extremely high mark, generally over 95%.
Yeah.
Because you have to show that you know the information that the other students learned in 3 years.
Yeah.
But okay, if you're determined enough to do it, you will find a way to do it. I'm not sure if there is a similar program in the UK, but there should be. Like in America, I know you guys do the MCATs.
Yep.
Which is the medical college admission test or something like that.
Yeah.
How long are they? Let me check. MCATs approximately 7 hours and 7.5 hours.
Yeah.
To complete.
It's a big one.
Covers biological and biochemical foundations of living systems, chemical and physical foundations of biological systems, psychology, social, physiological, social, biological foundations of behavior, critical analysis and reasoning skills. Where the hell did I put my glasses? I think I left them downstairs. So look, I would not go to America for med school, to be honest.
What? Yeah, no, you probably shouldn't. We're not very high ranked in the world, so you're not missing out on much.
Bachelor's degree in medicine. There we go. For the UK. I'm just gonna paste that there.
Sweet.
Where did it stop? Because this is long.
Whoa.
Yeah, it's long.
With at least 36 points overall. International Bachelorette with 36 points overall.
Yeah. And then that's all the requirements. If you add those two together, I'll send you the link to what I was reading, Ika.
Ika, we don't call things gay when they're not cool. Because all the gay people I know are cool as hell. Can the bio and math be interchangeable?
You need to do both.
Yeah, I think you have to take both to the maximum out to a bachelorette degree, which you would already have the bachelor's requirements for any other degree by the time you finish doing the requirements for those. Even one in like biological science. Because that's all the bachelorette level is going to cover anyway. You're going to have to go beyond that.
The reason for the calculus is a lot of the certain specializations like radiology and what do we call it?
Understanding wavelengths and logarithms and shit.
Yeah.
Or like infinite as it approaches zero, but never zero kind of shit.
Oh, what's this? So oncologists, the ones that do radiation therapy, they have to calculate all of that so that the two beams meet at the specific point where the tumor is.
Oh, fuck.
I'm not sure if there's software and tools that help do that, but because I'm not in the oncology sector.
But you need to understand what those tools are doing, if nothing else.
Yeah.
That's interesting.
It's a very... Because if you don't calculate that correctly, you're going to have the radiation going into the wrong spot.
Yeah.
Which is pointless. Because then you're not hitting the tumor. You're like, hey, tumor survived, patient died.
Yeah, let's make more tumors over here instead.
Yeah. But also, you need good maths ability because you need to be able to calculate doses very quickly.
Yeah. What vocabulary work can I do? Oh, what voluntary work?
Me
who needs vocabulary work, apparently.
Yeah. Sometimes I do too, especially when I don't have my glasses on.
Yeah.
You see, I didn't have to do volunteer work specifically in the health sector.
Just had to be a volunteer.
You just had to show that you were doing charity work or volunteer work at some level.
Okay.
But what you could do is volunteer at an old age home.
Yeah.
Or
Hospice.
Hospice, place for the disabled.
Right, so that way you're for certain getting at least medical tangential stuff.
Yeah.
No, you spelt it correctly, Ika. I just read it wrong.
Yeah. Yeah, I've got the Twitch thing on my big screen and then whatever I'm looking at on my small screen, so I can actually read the Twitch stuff properly.
You can read that easier. Gotcha.
Yeah. Like I can't, like when you Google something, the big blue text,
Yep.
I can't even read that on the screen without squinting.
Damn. That's pretty bad. Does that
Volunteer
pay?
work does not pay.
Usually does not.
It's voluntary.
Yes. So how did you get involved with the charity you work with?
I met a guy at a bar. We became friends. He was the bartender, and he would skip adding items to the bill.
That's nice.
And then one day he was like, "Hey, I know a free place to drink." Took me there. It was this charity place's clubhouse. Next time they had a meeting, I was there.
Nice. Huh. Ika says they're going to be so poor. You will for a while, and then you won't be anymore. I mean, you'll owe
Especially
student
if you
loans,
become a doctor.
but I mean, student loans get paid back, but like within a few years.
I didn't have student loans. I was lucky.
Fucker.
Paid for it up front.
Oh, goddamn. That's nice.
Well, I didn't.
Right. Family.
Parents.
Yep. That's a big help. The rest of us,
Yeah, especially
the rest of
when
us
you're
gets loans.
Especially when your dad makes more than your annual university fee in less than a month.
Ika, years are only a long time when you're young. Every year of age you gain, you're like, holy shit, I only have a year to do this? Like, that feels like no time at all. 2019 was a fucking blink.
Trust me, once you get into med school, time is like, where did it go?
You count from
Like, I'm writing tomorrow. I thought I had a month.
You count from midterm to finals, and that's that.
You count the seconds. Because that's how efficient you have to be.
Oh, God. Yeah. I had full-time work, full-time school, and I was also trying to like do a whole DJing thing in my off time, and like that alone is enough to drive you mad. And I was just in fucking like my bachelor's program. Like that wasn't even hard shit.
Like, I treated myself this for Christmas. I bought something for my office. So if people see me using the e-cigarette thing, I get in shit.
Right.
But what I've done is there's a camera that has been there that I can always access.
Right.
Show me who's in the waiting room of my office.
Uh-huh.
But there was glass, so you could see straight into my office because the office I'm in is not where I examine patients. That's in the room next to me.
Okay.
So that room has no windows that you can see into. But what I did was I bought this glass and replaced the glass that looks into the waiting room with glass where I click a button and it frosts.
That's nice.
Yes, Ico, maths is mandatory.
Yes, it is. So you bought this just for your office at the hospital?
Yeah.
Well, fuck it. It's your office.
I'm going to be in this office for who knows how long, because I don't plan on leaving this hospital. And it's not like I can't take the windows out and take it with me.
Right, true. If they fit exactly into the windows of your next place, but
No, I can get them cut again.
okay. You're gonna learn to like math, Ika. Trust me, you're gonna learn to love it.
The only reason you don't like math is probably because you're getting a bad mark in it.
Yep.
If you practice math, you will enjoy it because you get a good mark in it.
It's like if the second you get it, you're gonna get an A in the class. Everything else is just like trying to get it.
Like I struggled with, what was it?
I just don't like it. Yeah, well,
I struggled with discrete maths.
what is that?
How do I describe it?
I like to look at math. So when I started college, tested into the very bottom level math, which is 080, and I had to take every single semester of math up through 150 to get my associate's degree, which was a bunch of stupid math classes when you could test into 150 and just take it and be done. So I had to do a whole bunch of dumbass math.
Discrete maths is the study of mathematical structures that are fundamentally discrete rather than continuous, such as integers,
Yes.
graphs, and statements in logic.
Yes.
But then when my professor explained the concept of it to me, I got it.
That they're expressions of real maths.
Yeah.
In different mediums.
Yeah.
Yeah.
And this wasn't actually part of my medical degree. This was part of my minor for computer science.
Okay. Okay.
Because I was doing this as well, so I had to do PHP, Python, C++, Objective-C, and then a whole bunch of databases.
When you start to get into like databases, I get. I kind of intuitively kind of jive with databases, but like graphic interface is weird when you start trying to tell it to like do certain patterns across certain XY values as expressions to make different things happen. I can't. My brain doesn't. Do you know what CXC is?
Never heard of it.
Why did you need to learn a coding language?
Because I did a minor in computer science,
He just
which
did it for
I am
fun.
going to upgrade to a degree after I'm finished medical school.
For shits and giggles.
No, I want to go into designing artificial organs. So the first step was learning how to program them.
Yeah.
Then go into robotics. And before all of that, the first step was medical school, because if you don't know medicine, how are you going to do that?
Right. Now, you don't have to take a test regarding like coding or anything like that, Ika, but you'll definitely have to take a test regarding your math skills.
She's referring to the CXC, I think.
It is some test that I have to take. Oh, interesting.
What is CXC? The Caribbean Examination Council.
Okay.
And it's an examination council. And is this like to get into university?
It's like the GSCE.
Yeah, so it's like to get into university.
So it's some standardized fucking grade your abilities bullshit. Study up?
Ika, the best thing to do is look at the exact programs you want to do. Look at the requirements. So you want to do medical school. Look at the requirements for it. break that down into little goals and tick them off one at a time. That's the only way to get through them.
Yeah.
Because if you just say, I'm going to go to medical school, and then you go to medical school, and then you're like, I'm going to pass everything. You need to break everything down so that you know what you need to do to pass each thing.
Right.
And then you need to reevaluate that as you go so that you can identify your weaknesses and fix those. Because if you let a weakness stay a weakness for too long in medical school, you're screwed.
As far as like a field of study?
No, as in if you have a weakness in a subject and it's one section of that subject or that module,
Right.
if you let that weakness stay there for too long, you're not going to have the time to catch that up.
I see. He's meaning like weaknesses in further along studies, like a.
Because in medical school, it is basically learn, test, learn, test, learn, test, learn, test, learn, test
Right.
in a very rapid cycle. And you are constantly learning new things. So you don't have the time to go back and fix things if you wait too long.
Yeah.
You've got very short cycles that you have to do this in.
That's the case early in college. I noticed that, where I was like, oh, fuck, if I slip at all, I'm behind.
But this is every
Yeah.
part of medical school.
Yeah, I can't imagine. Like, there were some classes I was able to fuck around in. If every single class was that way, I'd be chewing my fingers off.
The only thing that we had was something 101. I can't remember what it was because it was so stupid. It was things like how to study.
Oh, God. Yeah, that would be.
It
That's a
was
write-off.
safe sex. It was.
That's nice of them.
I'm like, I'm in medical school. I'm learning about this shit already.
I know about safe sex.
I don't think I should be a doctor if I don't know about that.
Oh, fuck. That's funny. All right, Nick, I'm getting
There was
tired.
a whole bunch of stupid shit that you had to do in that subject. It was ridiculous.
I think I'm going to have to call it here in a minute. I'm getting pretty tired. I didn't take my nap for the day. I've been yawning and yawning. But
okay. And we can do this again if you want.
Hell yeah.
You just let me know when and I get the girlfriend to take over.
Awesome. I've loved it, dude. This is a really fun chat.
Sweet, man.
I will talk to you later then.
Sweet.
Adios.
Cheers, man.
Bye.
I'm going to go yell at David now. Cheers.
Bye. Good luck, David. Oh, my ears. Headphones too long. Oh, man. That was cool. That was really cool. And obviously Nick's a regular around here. So you guys have seen him in chat many, many times, and he's always around in the Discord. And he has made himself available to us for basic medical questions that we may have. He has said that you can shoot him a message if you want to ask him something privately. So all of these are good things. He's Nick Zasa in our chat, Z-A-S-A. And obviously he's a very cool guy. And I hope that you guys all enjoyed the chat with him. My mother called me back, and then she was like, I want to talk about something else. I was like, okay. So we talked about personal life stuff, and then she was like, I'm getting a phone call, I'll call you back, and never did, because she's a bitch. We have a cleric now. Yeah, alright. I am getting tired. I don't know why. I keep fucking yawning. I didn't have my nap today. I got off the computer and then I talked to grandma for a while and then talked to mom and then got back on. So, boop, boop, boop. Yeah. So, let's see. Tomorrow is Crafts Day. Crafting Day. crafting day and gaming night. Heck yeah, guys. That'll be fun. Yes. And then Saturday, crafts. Making things with our hands. We're going to make stuff and paint things. And then Saturday, I think I'm playing 2 Dungeons and Dragons games. I think I'm going early to a D&D game. And then playing in it, and then staying and dungeon mastering. Well, we'll see. We'll see how that goes. You got 12,000 bones bucks this stream. Wow. You guys are getting there, man. All right. Let's call it. Let's call it there. It's a good point to end. I don't need to put a marker because I'm just going to end here. All right, guys. I will see you in the morning. And I love you all. Have a wonderful night.